The pulmonary valve, essential in preventing blood from flowing back into the right ventricle from the pulmonary trunk. It consists of 3 semilunar cusps. The pulmonary valve is located at the root of the pulmonary trunk, a component of the right ventricular outlet, supported by the right ventricular outflow tract. It comprises the sinuses, the pulmonary valve itself, and the interleaflet triangles. Upon closer examination, the pulmonary valve is found at the top of the conus arteriosus, forming an opening and surrounded by the right ventricular myocardium. Taking a closer look at the opening of the pulmonary trunk reveals that it is circular in shape and positioned at the top of the conus arteriosus. Focusing our attention on its 3 cusps, we should know that they are named based on their positions: the left semilunar cusp, the right semilunar cusp, and the anterior semilunar cusp. The right semilunar leaflet is one of the 3 leaflets of the pulmonary valve positioned on the right side. Similar to the right leaflet, but located on the left side, we can identify the left semilunar leaflet. Positioned anteriorly is the anterior semilunar leaflet. It is also known as the non-facing leaflet because it is positioned the farthest away from the aortic root. A closer look at the pulmonary valve's semilunar leaflets reveals structured components essential for its operation. At the core of each leaflet, positioned midway along the free margin, is a central nodule. This is known as nodule of semilunar leaflets or nodule of Aurantius. Next to these nodules, we can see the lunules, crescent-shaped areas that extend from the nodule along the free margin of the leaflets. These lunules allow the valves to seal effectively and prevent backflow of blood. Completing the structure, the commissures are the areas where the edges of 2 leaflets meet and adjoin with the wall of the pulmonary trunk. This junction is fundamental to the cohesive operation of the valve. Exploring the area surrounding the pulmonary valve reveals the presence of the sinuses of the pulmonary trunk. The sinuses of pulmonary trunk are essentially 3 widenings located at the base of the pulmonary trunk. They create a dilation in the wall of the initial portion of the pulmonary trunk. The sinuses are categorized based on their spatial orientation relative to the pulmonary trunk. They are known as the right sinus of pulmonary trunk, the left sinus of pulmonary trunk, and the anterior sinus of pulmonary trunk. The right sinus corresponds to the right cusp of the pulmonary valve. The left sinus aligns with the left cusp, and the anterior sinus is associated with the anterior cusp. Taking a closer look between the sinuses of the pulmonary trunk, we can observe the interleaflet triangles. These are fibrous anatomical structures situated at the base of the pulmonary valve leaflets, defined by the junctions where the leaflet edges meet and attach. During ventricular systole, the phase of the cardiac cycle when the ventricular muscle contracts, the pulmonary valve opens. This opening is essential for allowing the pulmonary artery to fill with blood, which is then pushed into the pulmonary circulation. In contrast, during ventricular diastoles, the relaxation phase of the ventricle, the pulmonary valve closes. This prevents blood from flowing back into the right ventricle from the pulmonary artery.